Trans fats are banned in the US because they have been linked to various health problems, such as heart attack, stroke, type 2 diabetes, cancer, increased LDL, decreased HDL, inflammation, autoimmune diseases, infertility, tendon and bone degeneration. Trans fats are also believed to damage the inner lining of your blood vessels, known as the endothelium. The study showed that a beverage with high levels of trans fat impaired the function of the lining of blood vessels and increased insulin resistance when compared with a high saturated fat beverage. This may help explain the association of trans fat intake with cardiovascular disease. More recently, a study of 111 subjects with coronary artery disease found a clear correlation between increased consumption of trans fatty acids with the severity of their arterial lesions. Recent studies have examined trans fat's effect on cancer, finding a connection between trans fat intake and an increase in breast, prostate, and colorectal cancers. Trans fats are created when liquid vegetable oils are partially hydrogenated, a process that turns them into a solid form and increases their shelf life. Before the FDA restricted their sale, partially hydrogenated vegetable oils were the largest source of artificial trans fats in the diet because they were used to increase the shelf life of many foods such as crackers, cookies, snack cakes, and other snack foods. In 2018, the Food and Drug Administration, FDA, banned the use of partially hydrogenated oil in most processed foods in the U.S., effective in 2020. Several other countries have taken similar steps to reduce the trans fat content of processed goods, such as deep-fried foods, spring rolls, chicken nuggets, frozen hash browns, French fries, ready-to-eat frozen foods, quiche, burritos, pizza, pizza pockets, French fries, egg rolls, veggie, and beef patties, hard, stick, margarine and shortening, commercially baked goods, donuts, danishes, cakes, pies, convenience foods, icing, puff pastry, taco shells, pie crusts, cake mixes, snack puddings, liquid coffee whiteners, packaged salty snacks, microwave popcorn, chips, crackers, packaged sweet snacks, cookies, granola bars. Trans fat can also be found naturally in some foods. Meat, milk, and butter naturally contain small amounts of trans fat. The trans fat found naturally in foods is different than manufactured trans fat and does not increase your risk of heart disease. You will need to read the nutrition facts table to know for sure. Food manufacturers must list how much trans fat is in their foods on the nutrition facts table. Because of this, many food manufacturers have changed their recipes. A large number of packaged foods are now reduced in trans fat or are trans fat free. However, many food companies have replaced trans fat in foods with other types of fat, especially saturated fat. It's not a good plan to switch from trans fats to saturated fat. Too much saturated fat can also increase your heart disease risk. Here's how to reducing the amount of trans fat you eat. It is difficult to completely stop eating trans fat. The goal is to eat as little trans fat as possible. Remember that just because a food is trans fat free does not mean it is fat free. Try to eat more vegetables, fruit, and unprocessed whole grains. These foods contain no trans fat. Avoid deep fried foods. Choose grilled, steamed, broiled, or baked instead. Cook at home whenever you can. Read nutrition labels on packaged foods to make lower saturated and trans fat choices. Choose leaner meat and lower fat milk. Lean meats include pork cutlets, extra lean ground beef, and skinless chicken and turkey breasts. Choose dairy products like milk, yogurt, and cottage cheese with 2% mf, milk fat, or less. Use healthy monounsaturated fats, such as found in avocados, nuts, seeds, olives and olive oils. Also use polyunsaturated fats, such as sunflower, soybean, and flaxseed oils, fish, walnuts, and flax seeds, most often. Thank you for watching. Press the like button and subscribe for more health content.